graduated from an accredited graduate nurse practitioner program, and passed a national certification exam as a nurse practitioner. In the state of Georgia, they are also required to have a regulated, ongoing contractual relationship with a physician. That contract is creating challenges. Our first speaker by Georgia Watch enumerated many of those. Those challenges are adding to this geographic clustering that many people have talked about with healthcare providers in the state. It is causing delays in care, and it's inhibiting the state's ability to make full use of a workforce that you already license and have on the ground in the state. In working with states across the country, we get asked really three main questions. What is the safety and quality, and how does it compare? What are the economic impacts of this change? And what role does licensure play in access to care? So fairly quickly, we're going to hit on those points in the presentation. Your packet also includes a handout with more detailed studies and a bibliography, and you're welcome to take a look at that, and I'd be glad to provide you additional information. Nurse practitioners are the most studied healthcare provider out there. There are hundreds of studies going back 40 years on the safety and quality of nurse practitioner practice. And in fact, I was at a conference a couple weeks ago meeting with someone who is a national workforce researcher. He's not a healthcare clinician, he is a researcher that's geared towards workforce. How do we get people where we need to be? Where are they now? What are their motivators? And he said to me, Tay, really the volume and the weight of the research around nurse practitioners means the question of quality and safety is answered. That's no longer a question. However, when states are approaching this issue, I know that we need to go back through that research. So I pulled out three of the meta-analysis that have been done on nurse practitioner practice. Meta-analysis, I know you know, but I will feel better to say it, are a look at a composite of multiple studies that have been analyzed and distilled down to say, of all these studies, what do we know about this particular phenomenon or issue? So the first one that I want to point out is the Newhouse meta-analysis. This one took 20 years of data from 1999 to 2008 and analyzed all of the data related to nurse practitioners. It included both randomized controlled studies as well as observational studies over that 20-year period. After deep analysis, the researchers concluded that the quality of care provided by NPs was comparable to the care provided by physicians. The other meta-analysis, the Cochrane Database Systematic Review, also did an across-the-board analysis of multiple studies going across several years, and also determined that the quality of care provided by nurse practitioners was on par with, with the quality of care by physicians, and also noted that the cost and resource allocation between those two disciplines was also similar. More recently, the Institute of Medicine undertook a groundbreaking work related to nursing and how our country can utilize nursing to help meet healthcare needs across the board. Part of their work was to take a look at the body of evidence related to advanced practice nurses and make recommendations. In speaking to several folks who were on that research group, they tell me, Tay, this wasn't a slam dunk. We didn't all walk into the room and think, yep, this is where we're going. But after reviewing all of the evidence, distilling them down, they came to the conclusion that the evidence does not support a conclusion that APRNs are less able than physicians to provide safe, effective, and efficient care. They also found that states that had more restrictive scope of practice, so more restrictive licensure laws, did not have better safety or better quality than states that did not require that contractual relationship with physicians. Senator Unterman, I heard you talk about going to an opioid meeting earlier in the week. We have legislators across the country who are also asking, what about opioid prescribing? And the current research is showing that prescribing patterns between physicians and independently licensed NPs, so those who can prescribe independent of a physician relationship, that those prescribing patterns are similar. A study came out last year specifically looked at licensure laws across the states, those that required a relationship with a physician and those that didn't. And in that study, they found no evidence to support an argument that independent prescribing by advanced practice nurses increases prescriptions or increases the potential for abuse in states. Currently, there are 22 states in the District of Columbia that authorize independent prescribing by nurse practitioners. Cost effectiveness, again, overall the research is strongly supporting that nurse practitioners provide cost-effective care to patients. And I've just pulled out a couple of items that I think would be informative to the committee. The Trzynski article is actually one that was done by economists. These economists looked at 17 states that provide full practice authority, authorized nurse practitioners on a license solely regulated by the Board of Nursing without a relationship with a physician to practice, and compared those to states that were more restrictive. They found that in those states that had full practice authority, there was an increase in access to care. There were fewer emergency room visits for issues that could be managed in an outpatient primary care setting, such as asthma exacerbation, refills of medication, and primary care issues, and that the productivity of both physicians and nurse practitioners increased. I picked this particular article because the researchers noted that these benefits were not because nurse practitioners were migrating out to rural and underserved areas, although they do, and we'll talk about that in a minute. In this particular study, they attributed these cost savings productivity increases to the removal of unnecessary physician supervision and oversight.